Ebola in Texas. The first patient dies, and in the days after his diagnosis, doctors admit their mistakes.
Regretfully, that information is not fully communicated throughout the full team.
The governor calls for federal response as Homeland Security orders stricter screening at U.S. entry points.
We have the ability to track individuals all through the air transportation system.
And a statewide task force to protect Texans from this deadly disease takes shape.
We would all be fools to believe we're not going to learn lessons.
Thank you for joining us for State of Texas in Depth. I'm Josh Hinkle. Thomas Eric Duncan flew into the United States last month from Liberia, the country hit hardest by Ebola. This week, he died at a Dallas hospital. Early decisions made by doctors and nurses have come under fire, and the nation has turned its eyes to see how Texas will react as the first state with a patient diagnosed with the virus. It's part of the reason Governor Rick Perry announced this week the creation of a task force to prevent and prepare for the spread of an infectious outbreak. On that task force, a man I spoke with this week, the state's top health official, Health and Human Services Executive Commissioner Kyle Janik. With your role on the task force, what do you think can be accomplished in such a short amount of time while people have Ebola right here in the forefront?
The first thing is better information out there to everybody so that rumor and misinformation don't take over. I made the point in there that just yesterday I met for the first time a renowned researcher, one of the best in the world, who just returned from Sierra Leone 10 days ago. I had no hesitation whatsoever in shaking his hand. And so that kind of message to people that we've got smart people working on it, but the real good message in all this is that the day-to-day things that we already do, bread and butter, not sexy kind of stuff, the routine public health measures. Number one, good care, identifying diseases quickly if they pop up. Secondly, following up on anybody else who had contact with that patient and then looking at their contacts. So casting a wide net to find anybody who could potentially have been exposed to the virus, and then one by one eliminating them from the pool of being low or high risk, and then watching them for whatever that incubation period is. For Ebola, it happens to be 21 days.
As the state's top health official, how have you seen other states trying to look at what Texas is doing right now?
Well, because we've not had a case pop up in the country before, other states have probably been doing some of the similar things that we have, which is getting ready for what if. What if each state says, we could be the first, are we ready for that? You can think you're ready and you can try to get ready, but it's only best when you have an outbreak, or a single case, I should say, that you start to look at the practical impact of your protocols and your policies.
A new federal policy this week: airports and other ports of entry must observe everyone coming into the U.S. for potential signs of Ebola infection. There's been some concern that this could slow down the immigration process and might not catch all carriers, since some might not be symptomatic yet. Texas Congressman Michael McCall, who chairs the House Homeland Security Committee, also spoke this week about passengers sneaking through security.
So if someone comes through and they have a high, body temperature, they could be pulled aside. We have technology out there that can monitor body temperatures, and that's something that we have been looking at to potentially deploy to some of these airports.
Agents will also hand out fact sheets to travelers with details of what symptoms to look for and directions to call a doctor if they become sick within 21 days. Officials also continue to monitor people who had contact with Thomas Duncan, but the Center for Disease Control says it's important to be aware of the actual risks. Ebola is not an airborne virus. The only way people can catch it is through bodily fluids of someone who's infected only after that person has started showing symptoms. Right now, there is no vaccine for Ebola, but if one becomes available, the state already has a system to track vaccinations among Texans. Earlier this year, we took an in-depth look at MTRAC, the state's shot registry. It allows the Texas Department of State Health Services to store your vaccination records electronically. Doctors, public health departments, and schools can access that immunization history to make sure important vaccines are not missed. A handful of Texas labs are working on a vaccine or are conducting heavy research into infectious diseases. Here in Austin, scientists at the University of Texas College of Pharmacy have developed a one-dose vaccine proven effective in some animals for Ebola. In Bryan at Texas A&M, officials recently dedicated a new vaccine manufacturing plant to protect against influenza and perhaps other future biological threats. And researchers first tested many of the Ebola vaccines nearly ready to begin clinical trials in humans at the UT Medical Branch in Galveston. This week, Governor Rick Perry toured those labs in Galveston. Two of the lab's workers are members of his new infectious disease task force.
The exceptional knowledge and experience that's been assembled on this team will streamline our response process and help us foresee any issues, hopefully, before they arise.
Later in the week, the governor visited Fort Hood, where troops were preparing for deployment to West Africa to combat the spread of Ebola. Officials say the soldiers will receive specific medical training and specialized personal protection before, during, and after the deployment. Our coverage continues online. Just search for Ebola on KXAN.com. From hospitals to labs and now to the state capitol, Ebola is even having an effect on the election next month. We take a closer look at the governor's race and speak with the U.S. senator hoping to hang on to his seat. Next on State of Texas In Depth.